Today we're going to talk about early childhood caries, also known as baby bottle tooth decay. So roll that intro, let's get into it. What's up everyone, Dr. Eric Jackson here. Hope you're all doing well. So I mentioned we're going to be talking about early childhood caries, often called baby bottle tooth decay, although it doesn't always have to involve a baby bottle. So let's try to stick to early childhood caries, right? Caries being the other word for cavities. First off, they're baby teeth, right? And I know maybe it comes as a shock to some of you, but ultimately we all come from different backgrounds, come from different knowledge base, and some of us are very knowledgeable about dentistry, and some are not. So I actually get the question, well, why do I even have to brush my kids' teeth? They're just going to fall out eventually anyways, more than you might think. So ultimately, why do we have to brush the teeth, right? Besides the fact that they look good, right? We want to have a nice smile for our children. They need to be functional. They need to be healthy, right? They have to chew food to get nutrition so they can grow big and strong. They have to make sure that they're solid and they're not decaying, causing potential pain and problems. But did you know that baby teeth are also very instrumental in making sure that the adult teeth come in correctly? It's true, they are. And we'll save that conversation for a different video. But in a nutshell, these are just some of the very few reasons, well, albeit huge reasons, but just a couple of the reasons why baby teeth are very important and we need to take good care of them. So what causes early childhood caries, right? Ultimately, the teeth usually affected, and this is where the baby bottle comes into play, is the top front teeth. Why is that? Well, because the name, as the name suggests, a very common cause of early childhood decay is putting your child to sleep, your infant to sleep, with a bottle of milk or formula or whatnot, a sugar-containing liquid. And then that child will then suck slowly and almost continuously on it overnight, and that sugary liquid will then continuously bathe the teeth and make sure that basically decay sets in inevitably. Sometimes it's very rapid, sometimes it's a little slower, but either way, rule number one, don't put your child to bed with a bottle. Have them finish the bottle prior to going to bed, please, and then put them to bed. As a side note, many people don't know cavities, gum disease, they're all bacterial in nature, right? And bacteria can be transferred from person to person. So, moms, dads, for all you out there, make sure you take care of yourself, because inadvertently you may be passing cavity-causing bacteria, gum disease-causing bacteria to your children, to your infants even, by sharing spoons, by giving, hypothetically even giving kisses. The transfer of bacteria back and forth can actually seed the child's mouth with these pathogenic bacteria that can really start them off down the wrong path early, especially if you've got untreated dental problems of your own. So take care of yourself, and therefore you'll be taking care of your children as well. I'd also like to take the opportunity to point out that this is the time of a child's life where you need to go to the dentist for the first time. So the recommendations currently are to take your child to the dentist upon eruption of the first tooth, usually the bottom front front two teeth, and prior to that child's first birthday. We want to make sure that the knowledge is passed along to the parents about all the different updates that there have been since the parents were children. And dental knowledge base, just like every knowledge base, is always evolving. Everything from fluoride recommendations to training toothpaste to all sorts of different things. Yes, the appointment will be primarily focused on educating the parents, but with that said, that's important. You've got to know those updates. So dental decay and many dental maladies are all dental disease, right? That's what we call them in the profession. And diseases can hopefully be prevented. That's why we do so much preventative talk, prevention, right? Yes, we can fix it, but ultimately, just like other diseases on the medical side, we want to protect and prevent on our dental side as well. So let's talk prevention of early childhood caries. Here are some good tips in no particular order. We already touched on one of them. We want to make sure we're not sharing saliva, if possible, with the baby through spoons or licking pacifiers or things like that. Part of that goes along with making sure you take care of your own mouth, so that way you're not inadvertently passing excessive amounts of harmful bacteria. When things are under control, the human body can actually take care of this sort of thing. But rampant gum disease in a parent can actually, or rampant decay in a parent's mouth can actually transfer surprisingly quickly, according to some studies. Another way to prevent these issues is making sure you're taking care of the teeth on a day-to-day basis. When the child's tooth comes in, you got to start brushing it with good fluoridated toothpaste, right? How much is the key. No longer do we recommend, we the profession, do we recommend the training toothpaste of yesteryear. Now we use a great brand name, ideally with the ADA seal of approval on it, toothpaste, such as Crest Kids. That's kind of my go-to one for both my children and my pediatric patients. Sparkle Fun. It's honestly, kids love it, and it just looks cool and it tastes great, and it's just wonderful. Mint can be too strong sometimes for some kids, and nobody complains about Sparkle Fun Crest, which is A plus in my book. So when you brush their teeth, you have to make sure you use the right amount because yes, they're going to ingest a little bit of the fluoridated toothpaste. So you want to use just the smallest little bit, right? It's got to be a smear, a smidge, half a grain of rice, or a grain of rice, so to speak. That's the kind of visualization we want to do. The key is that you're still brushing with just a little bit of fluoride toothpaste to get it in the saliva, to get it on the enamel, and it's really proven to cut down on early childhood decay. So you want to use that small amount, that grain of rice smear amount, until the child is about age 3. Then that child is usually large enough to graduate to the next size, the next volume of toothpaste. Would be more like a green pea, right? A little bit bigger dollop, because they've got all their baby teeth in, usually by the time 3 years old rolls around, often earlier. Make sure you're supervising, right? We see it, unfortunately, a little bit too often. You've got very intelligent child, very well-behaved child, just an overall really awesome kid, right? They're still children, and many adults, frankly, don't understand that you have to put the time in every single day, whether you want to or not, to keep your teeth clean, right? You brush them in the morning, you brush them after school, if possible, then you brush them at night before you go to bed. That works really great as long as you're supervising them, right? So do you have to brush your child's teeth? Well, you don't have to, but you have to make sure that this is getting done well, and it's getting done correctly. And I think that's just one of those things where you got to have so whatever floats your boat as a parent, you can do it yourself. There's a large school of thought that, heavy supervision, or even potentially brushing your child's teeth, as a parent brushing their child's teeth until the child can really effectively tie their own shoes. That could vary, in age, of course, but I think it's a pretty good parameter. But based on the fact that it's all about manual dexterity, it's about the ability to do that. And by the time they get to the age where they can tie their own laces, you might be able to give them a little bit more leeway. Then again, I never tell people how to parent. These are just good ideas about what to consider and what works well in your household. So we touched on bottles, right? We want to make sure that we are not putting the child to bed with a bottle. There are many other alternatives, pacifiers and thumb sucking, and those have their own pros and cons, of course, but ultimately neither of which, the thumb or the pacifier, is a sugar-coated liquid that will continuously bathe the teeth. So of the 3 items there, those classic 3, definitely the worst is the bottle, so please just don't do it. Be sure the child finishes their bottle completely, if possible, right before they get put down to bed for their nap or for their bedtime. It just helps the saliva to then accumulate pH balance, rinse away the food particles, or in this case, rinse away the milk droplets. And milk does contain much more sugar than you might think. You can have, frankly, the most pure, amazing organic milk in the world, but there is a natural sugar content to it. And then there's the other discussion that, is additional sugar being added at the human level in production and whatnot. So ultimately, these are all things to kind of consider, but really all milk has some sort of sugar in it. It's not a sugar-free liquid, so get it, enjoy. and then be done. For those that are breastfeeding, of course, that's not an issue. The child will doze off to sleep, and then you can put the child to sleep. So ultimately, this is really truly a bottle issue, because saliva is there to remove and naturally kind of wash away and cleanse the milk, the formula, the breast milk, whichever you're using. You have to give it a chance, though, to do that. It can't be constantly bathing the teeth at night. And I mentioned pacifiers. It's important to just use a pacifier. If you're going to go down that route, don't dip it in things, sugary containing things, or frankly, really much anything if you can. But a lot of the classic parenting tips or parenting moves, if you will, are dipping it in some honey or some sugar and getting them to really like it and whatnot. That's just not good for the teeth. It just introduces more and more sugar to the mouth. It makes it much more difficult for the saliva to do its job. And so please just avoid that. In addition, we want to get out of the bottle phase as soon as possible, really. There's orthodontic concerns. There are speech concerns with using a bottle too long. We want to graduate to a training cup or a sippy cup or a tippy cup, whatever you happen to call those cups. That's a whole separate discussion, a whole separate video on training cups, sippy cups, about selecting the right ones. But ultimately, we want to get into a training cup by the first birthday, if possible. So you're getting your first dental visit by your first birthday. You're getting into a training cup, sippy cup by your first birthday. A lot happens at that first birthday besides just a little smash cake. And of course, there's the educational part of it. We'll go ahead and just touch on this briefly, but make sure, even though the child's little, talk about how important it is to eat good, healthy food, right? It's good for their medical side. It's good for the dental side. Perhaps consider taking the child with you if you can. We always love that when parents will bring in their children, whether they're infants or whether they're 1, 2 years old, just getting used to that appointment. That's very, very important that they watch you succeed at your own dental visit. It really helps to pacify any fears that they might have. And then it just becomes old hat. Hey, mom does it, dad does it, sibling does it, I can do it. And it was really basic psychology, but really by patterning after the people that most important in their life, seeing that they go through without a problem, it works really well. So even if it's not their appointment, bring them with them. So the more times they have come to the office, that overall, maybe they get a little sticker, maybe they get a high five from the dentist, maybe they have some fun, maybe they get to see the pictures. All sorts of great things can happen when they get more time in the dental office. It makes all dental visits easier for them. Lots of little tidbits here today. I know it's a little bit disjointed, but it's all under that umbrella of early childhood cavities. We really want to make sure that we focus on this, because it really is a layered approach to preventing this all too common disease in a young age child. So thanks very much for watching as usual. Appreciate your viewership. If you have any questions, comments, thoughts, go ahead and put those below. Of course, if you like the video, go ahead and give it a thumbs up and subscribe to the channel. Appreciate everything. I'll see you in another video. Have a great rest of your day. Bye now.